Spinal deformity treatment in Turkey, scoliosis and kyphosis are issues that are frequently encountered. These conditions can lead to serious complications within one's internal organs. Not all orthopedic doctors can correct such kinds of deformities. You can find such unique specialists in Turkey, and their services are much cheaper than in many other countries. In this video, we will show a Turkish clinic that treats even the most complex spinal curvatures, and we will introduce an orthopedic doctor based in Antalya, Turkey, who provides medical care to international patients. Subscribe to our channel and don't miss new videos about medicine in Turkey. Around 50% of the patients we treat are foreigners, because severe deformities such as scoliosis and kyphosis are often just left uncorrected in many countries. I think this is likely because spinal surgery and deformity correction is a very specific medical field. Even if a surgeon is well educated and well informed, he may not have access to the necessary equipment to carry out the required procedure. Thus, in addition to the doctor, a well-equipped hospital is essential. The company Healthy Turkiye, which organizes medical assistance in Turkey, believes that only the best specialists can be trusted with treating foreigners from abroad. If not, then there's just not any sense to fly from another country. To shed light on the topic of treating spinal curvatures, we consulted a specialist, one of the best orthopedic doctors in Antalya. Dr. Docent Ömer Buzduman, an orthopedic traumatologist specializing in spinal surgery, author of many scientific publications on this topic. He holds degrees from 2 universities and has taught students at 2 others. He has worked in many cities in Turkey and currently sees patients at an international hospital in Antalya. Conditions such as scoliosis and kyphosis occur frequently in people. Scoliosis can be described as a curvature of the spine to the right or left side. If the curvature exceeds 10 degrees from normal, it is classified as scoliosis. Various treatment options are available depending on the severity of the spinal curvature and the age of the patient. And kyphosis is characterized by hunchback. We all have a slight kyphosis, a deviation from the ideal. However, patients who come to us may have deviations even more than 55%, which appears as really hard hunchback.
Why it's so important to correct and treat spinal deformities? What makes them dangerous and why shouldn't we ignore them?
Well, you see, increased spinal deformities may exert pressure on internal organs of the body, which may lead to clinical symptoms. This pressure can also provoke further spinal curvature, leading to even more serious problems in the chest area, in the abdominal area. If the patient is elderly and has osteoporosis, treatment becomes even more difficult. There is a chance he may remain bedridden, and in severe cases, it could pose even a threat to his very life. All these problems you can see both in scoliosis and kyphosis and in other spine issues.
Spinal curvatures can be quite complex. Can you explain what technologies you use for diagnosis before starting treatment?
I want to highlight an important point before I answer your question. Even if the doctor has good images and interprets them correctly, but if he poorly examines and listens to the patient, then he will provide the wrong treatment. For example, if a child is brought to you and you notice many brown spots on the back, increased hair growth, or color changes near the spine, you recognize this as a sign of neurofibromatosis or an issue in the spinal canal. However, if the patient is only treated based on spinal images, it may result in irreversible problems, making it crucial not to overlook this aspect of the treatment process. What is needed for right diagnosis? First, we should look at an X-ray. This should not be just a chest or abdominal X-ray, but one specifically for scoliosis, showing the entire spine area of the patient. We take specific measurements to determine how and where the spine is curved, how hard the tilt, and we calculate it. Patients who will undergo surgery need an MRI, and we scan the entire spinal cord. We do this to identify diastematomyelia, congenital bone deformities near the spinal cord, or similar issues before surgery like a tight spinal cord. If you don't see these details, you might correct the spine, but the patient could wake up paralyzed. So, as I said, all patients require an MRI prior to undergoing surgery. When is an MRI also needed? If a patient is experiencing painful scoliosis, or if you suspect the patient's complaints are related to neurological issues. Second thing, tomography is also needed if there are bone issues like spinal spikes. If there is a tumor or infection, we often ask for scintigraphy. In most cases, special corsets, bandages, and some similar external devices can be offered by a doctor to correct mild spinal curvatures. But in severe cases, when the curvature has progressed too far or is complex, the help of an orthopedic surgeon may be needed using special technologies. Doctors in some Turkish hospitals fully possess these technologies. You can find some videos about different types of help from Turkish orthopedists in a special playlist on our channel. The link is in the corner of the screen.
Could you tell us about the different ways to treat scoliosis and kyphosis? We can illustrate it on this beautiful spine model.
Okay, for instance, the patient is a 10-year-old with scoliosis. The cause of the condition is congenital anomalies of the spine, meaning an excess or deficiency of vertebral tissue or fusion of vertebrae. If it is a small area, surgery can be performed to prevent the curvature from worsening. The issue can be resolved by fusing or removing excess bone. If the child has a curvature of 40 degrees or greater, we can place screws only at the upper and lower sections where the curvature is located, and in the center, we can put a dual or magnetic rod. This operation assists in the growth of the patient. These sections of the spine are like frozen, fused. After a certain duration, you stretch and elongate the spinal bones, permitting the child's respiratory organs to mature and progress. When we come to the realization that the spine will no longer continue to grow, we replace this system with a new one, ensuring the vertebrae are separated. Our objective is to minimize any necessary actions at the upper point where the neck connects with the back in order to safeguard the delicate tissue in that area. We initiate interventions from the lower part to ensure no limitations in the cervical area. As we embed this system of screws and rods, we set up different auxiliary devices under the patient's back, including a neuromonitor, direction indicators, and S-curve X-ray imaging. Rather than leaving empty spaces after removing unnecessary bones, we replace them with devices that help to generate new bone tissue. We don't put an implant there, as it would break without added support. An experienced surgeon must carry out this operation. The most proven surgical technique is fixation, often referred to as freezing. To maintain childhood flexibility and anticipate future growth, one option is to install a flexible fixator, allowing for maximum adaptability. Yet, for those whose growth phase is finished, this procedure cannot be performed, as such materials cannot have a lifetime warranty. Some surgeries involve several doctors with different specialties. For example, the patient has issues with a tense spinal cord or diastematomyelin. The surgery needs to be done by a team with a neurosurgeon with you. First, we must address the disease's causes and only then correct the deformities. If the patient has lung or vascular problems, your team should include a thoracic surgeon, a cardiovascular surgeon. People who have looked into spinal defect correction theme realize that these surgeries are not done in every hospital, as you need specialized equipment and a trained medical team. A special service company helps foreigners choose a clinic and arrange with a doctor in Turkey. This company also offers free initial consultations for individuals. The employees of this company are licensed medical professionals with experience in Turkish hospitals who understand the local healthcare system.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home. We also talk a lot about our work on our Instagram account. You can subscribe to our Instagram via the link or QR code to get to know us better and, of course, to understand how our company works in general.
What limitations will the patient face during and after the treatment procedures?
After the operation, we often have patients standing the next day, but they stay in the hospital. I visit the patients myself. In the ICU or wherever, I show and explain to the patient how to walk and stand correctly. Then we show and explain this to the family members. If spinal instability persists after surgery, we utilize a system of special support rods. We gradually expand this system. By the time of discharge, the patient walks on their own. For some patients, we also include a brace. It's like a safety belt for us. I tell most patients not to go out immediately after discharge. It's better to stay home at first. Gradually, we increase the number of exercises and physical activity. Based on the clinical situation, the images, and the patient's current state, the observation period may last a year or even 2 years. A common question is what happens to the metal devices in the body. Am I able to have an MRI with it? What will happen when I go through a metal detector? Patients can get MRIs, and metal detectors often do not trigger alarms. In case they do, we provide each patient with a document stating that they have such and such implants. These implants are compatible with the body. They do not need to be extracted later. If there are no complications, removal is not necessary. Kyphosis and scoliosis, which complicate life for many people, can be effectively treated. As you can see, advanced Turkish hospitals have such capabilities. Turkey differs from other countries with its all-encompassing approach to patient care. In other countries, each procedure often has a separate fee to pay. Healthy Turkey Company organizes whole medical tourist visits to Turkey under the all-inclusive system. It operates only with confirmed professionals both in the medical field and the hospitality sphere, managing all their tasks for each patient. Healthy Turkey takes care of all aspects, from consultations and arrangements with clinics and doctors to transfers, lodging, immigration formalities, and translations of documents. The address of the company's website is on your screen. There, you can find a lot of information about other medical assistance for foreigners in Turkey. Feel free to call with questions at this number. All popular messaging apps are working. Be sure to subscribe to our channel to stay updated on new videos about excellent medical care for foreigners in Turkey.